Hello. My name is Dr. François Ricard. I am an osteopath and a PhD. I am director of the International Madrid School of Osteopathy, EOM, and president of the Scientific European Federation of Osteopaths, SEFO. In this video, we will talk about the segmentary passive mobility tests for the pelvis used in osteopathy, also called mobility tests and dynamic palpation. The pelvis is the most problematic reliability area in manual orthopedic physiotherapy, chiropractic, or osteopathic medicine. It is probably due to insufficient or deficient training to perform these tests. In the study by Potter and Rothstein, 1985, a physiotherapist specialized in orthopedic manual therapy, they found poor reliability. 11 of 13 tests carried out showed less than 70% agreement. Smith and Gibbons, 1999, determined that the inter- and intra-exam reliability of the standing trunk flexion test for the 𝐸𝐴𝐵 inter-examiner agreement of 42%, and kappa coefficient of 0.052. Statistically insignificant reliability. 68% intra-examiner agreement, and kappa coefficient of 0.46. Moderate reliability. In the study by Levin et al., 1999, the sensitivities of the individual tests were low, 8% to 44%, as were the negative predictive values, 28% to 38%, to identify the presence of iliac torsion. Associations of test results with low back pain were weak, except for Ghele's test. Odds ratio 4.57. The study by Dreyfus et al., 1994, suggests that sacroiliac movement asymmetry, due to the relative hypomobility determined by these tests, can occur in asymptomatic or symptomatic joints. The results of the study by Albert et al., 2000, in pregnant women, showed that the inter-examiner agreement of the tests was high, between 88 and 100%. With the kappa coefficient, most of the tests had high agreement. Groups of 6 tests had an inter-examiner agreement between 0.81 and 1.00, of 3 tests between 0.61 and 0.80, and of 2 tests between 0.60 and 0.41. 5 tests showed superior sensitivity. The specificity of the tests was between 0.98 and 1.00, except for the value for the pelvic topography, which was 0.79. These results show that it is possible to standardize the examination and interpretation of clinical tests of the pelvic joints, resulting in a high degree of inter-examiner sensitivity, specificity, and reliability. According to the study by Vauha, 2004, the Downing test presents an intra-class correlation coefficient for the elongation test of 0.47, 95% C, 0.23 to 0.75, and for the shortening test of 0.36, C equals 95%, 0.09 to 0.70. Inter-ater reliability is poor. According to Bemis et al., 1987, the lower limb elongation test, from decubitus to sitting, as an indicator of iliosacral dysfunction, has a reliability of 0.01. The study by Van Kessel-Koblenz et al., 2008, examines in pregnant women the reliability of the psoas displacement test in anteversion and retroversion of the pelvis, the sitting hip flexion test, and the sideline abduction test. The overall kappa was 0.30, range -0.22 to 0.83, which is considered a bad deal. The percentage of agreement by test and category ranged from 45% to 95%. This study indicates that all three tests studied had poor inter-rater reliability. The study by Lowe et al. 2015, on the training and development of palpation skills in a population of osteopathic medicine students, demonstrated that the palpation skills of the participants improved from the beginning to the end of the training period. Regarding the inter-examination reliability of the 𝐩𝐽 test, or standing hip flexion test, the results are highly variable. They range from reliable for 2 studies, fair for 1 study, and unreliable for 2 studies. It is recommended to use the 𝐩𝐽 test, or standing hip flexion test, associated with other mobility tests to increase reliability. We believe that the biggest problem when performing this test is the correct location of the psoas. The protocol used by Fred Mitchell DO for palpation of psoas should be used. Riddle and Freeberger, 2002, in their study have examined a group or cluster composed of 4 tests. The percentages of agreement ranged from 60% to 69%. The kappa coefficients ranged from 0.11 to 0.23, and the proportion of positive agreement was less than 50%. However, studies by Korkmaier et al. 2002, Arab et al. 2009, and Robinson et al. 2007, using different combinations of tests indicate reliability ranging from good to excellent. The proper choice of the tests used for the test group is especially important. Conclusions. The pelvis is the most problematic reliability area, whether in orthopedic manual therapy, chiropractic, or osteopathy. It is probably due to insufficient or deficient training to perform these tests, particularly in physiotherapy. There are also problems in conducting many of the scientific studies described, whether of bias or methodology. It is imperative to improve the quality of studies on this topic. It is necessary to improve the training of dynamic palpation, as indicated by some studies. It is recommended, for the sacroiliac physical examination, to use clusters of test combinations to improve reliability, as recommended by some scientific articles. Korkmaier et al., 2002, Arab et al., 2009, and Robinson et al., 2007. Combinations of pain provocation tests, static palpation, and segmental mobility tests seem the most appropriate. Here you can find the list of bibliographic references used in this presentation, all based on scientific articles, which with a little patience can be found in PubMed.
Thank you for listening.